Year after year, nurses are seen as the most trusted and ethical profession in the United States. And we need more of them soon.
Well, America's nurses are stressed out and getting out. Data from one nonprofit shows 100,000 nurses left the workforce during the pandemic.
The National Council of State Boards of Nursing shows by 2027, about a fifth of registered nurses are going to call it quits.
Growing access to health care, an aging baby boom population, and more people suffering from chronic conditions are all contributing to an increased demand for nurses, according to the American Nurses Association.
On today's Block Club Chicago podcast, sponsored by Rush, a wrap-up to National Nurses Month, a conversation with two of Rush's registered nurses, one now an administrator, another a nurse navigator, on how Rush sets itself apart and why nursing remains a noble field for those who are ready for one of life's most difficult and most rewarding challenges. Dr. Rachel Start, Associate Chief Nursing Officer, and Mel Pugh, Oncology Nurse Navigator. Welcome to the Block Club Chicago podcast.
Thank you. Thanks for having me.
Let's start with what inspired you to become nurses.
To be honest, I did really good in high school as a writer, wanted to be an English teacher. My parents neither went to college. They managed a bathroom remodeling business. And one day my dad came home. He said, I just did the bathroom of two Rush advanced practice nurses, and they seem to be doing really well. You should think about nursing. And certainly I was raised with certainly a strong faith and a focus also on mission and making things around me better. So I ended up switching gears, going into nursing. It has fit me my whole life.
That's great, Rachel. Mel, how about you? Where was that seed planted in terms of becoming a nurse one day?
It sounds kind of silly, but whenever I was sick as a kid, my mom always took good care of me, and that kind of made me want to be a nurse. Once I was in college, I studied women's studies, and one of my professors was a midwife, and she talked a lot about disparities in healthcare, specifically how healthcare is gendered. I realized I just kind of wanted to do nursing more in general. So then after college, I went back to school for nursing.
Rachel, obviously you work more as an administrator now, but I know you worked with HIV patients and cancer patients and in the neuro departments as well. What sets Rush apart? Like, is there like a mantra at Rush and the nursing staff?
Rush nurses are taught from the very first moments that we are leaders in our space, that we are to take what needs to happen for the patient, or even in my role now as an administrator, the population, and advocate for what the patients need, listen to those with expertise at the front line, and mobilize that into resources. And, at the front line, when you're in direct care, that means making sure the patient's wishes are adhered to, that if there's coordination or navigation needed because our health system is fragmented, it's the nurse that does that work.
And you mentioned the word navigator, Mel. That's literally in your job title as an oncology nurse navigator. I imagine you'd echo what Rachel says about kind of the broader look at our healthcare system and why we need a navigator, someone to kind of walk us through it like you.
The healthcare system in the U.S. is pretty complicated and difficult to navigate. There are nurse navigators who help patients on the ambulatory or outpatient side of healthcare navigate their care. So specifically, I work with stem cell transplant patients, and they're very complicated and can be very sick for a long time. They come to our clinic twice a week for a while, for months on end, and they have a lot of follow-up appointments needed with different specialists, with us, lab work, tests. And so it's hard for them to navigate with insurance and coordinating all these different appointments and just understanding what medications they should take. We triage calls from them about any new symptoms they have. So we're really kind of like overseeing their whole care plan.
Rachel, clearly you work with a lot of Rush nurses and have for a long time. Okay, so then fill in the blank for me. The Rush nurse blank.
I think the Rush nurse learns leadership. I've said that many times. And so when we get involved outside of Rush, which I have done extensively, we add some level of leadership even to other healthcare leaders because it's kind of our culture and legacy. I found that I've had great success in professional organization work by saying things that would be simple at Rush, like something that would be expected at Rush, but it seems to be out of the ordinary in other places in terms of, hey, I can do that. Like, let's just organize it this way, or how about we set a timeline, like things that would be basic at Rush in terms of holding accountability, moving things forward, seeking outcomes. That's something that we're taught.
Mel, as you help patients kind of navigate this difficult healthcare system we've chatted about, like where does that start, right? I mean, you're kind of on an island, I'm sure, in some ways. You're the one person that's really pushing for the patient, but you're part of a bigger group. So, like kind of walk us through that.
I work with a big team. I work with a bunch of other nurses and nurse practitioners, PAs, attendings. So we all work together. We have a social worker, a pharmacist, insurance coordinators. So a lot of times they call us nurses first, and then we can kind of direct them where they need to go.
That's huge. You must develop a good relationship with people who find you to be extraordinarily useful and helpful.
Yeah, that's my favorite part about my job is these patients are so sick for such a long time that we do really get to know them. I know like very small details of their lives that other people wouldn't know, or like I know what time of day to call them because I know what time they wake up in the morning. I know what family members they get along with and which ones they don't. And all those little pieces kind of add up, I think, to make them feel like they trust us and like they can come to us. And I like how it feels like every day is kind of like putting puzzle pieces together for different patients and individualizing it how that person best needs their care.
Rachel, I think a lot of us get our impression of what nursing is, what that profession is like based on TV shows and movies that we see, which of course is not the reality. What are maybe some areas of nursing that we don't understand, we don't see as much? Maybe when we hear the term nurse, we don't picture this.
It's in the community. It's managing chronic populations even by the phone. It's where you go into your doctor's office, but that's not always a nurse. There's sometimes a nurse that's overseeing a couple different offices for outcomes. So I understood that if nursing in the outpatient setting didn't have the same level of empowerment as the inpatient, what I had been used to, that potentially there would be a miss on how greatly their outcomes could improve.
Obviously, it goes without saying that nurses have medical training, right, and a knowledge that helps get better patient outcomes working with the big team of doctors and nurses and everyone that you mentioned, Mel. But I feel like so much of your job, and really all nurses' jobs, is like part psychologist too, psychiatrist, whatever you want to say, that person that holds their hand. It's as much about the mental health, I imagine, in some ways, as it is about the physical health.
Yeah. Nurses always joke that we kind of play every role. I used to work on the hospital side, on the inpatient side, and we would take meal trays out of people's rooms. And then the next minute we would be having a goals of care conversation about going to hospice.
What about you, Rachel?
Actually, some of the most meaningful memories I have is when I was able to provide comfort for somebody that was dying, provide comfort for family, advocate for the right family members to be at the bedside.
I see these patients for a long time, and even if they relapse and they get bad news, I get to go in the room after the provider was in there and just give them a hug and let them cry and sit there with them.
I think what nurses do really well is we see the full holistic picture. So we don't just see somebody in front of us with cancer or HIV or a spinal problem, but we also see that there's a lot of factors around them that are either supporting their health or not supporting their health. And honestly, nurses carry a ton of serious and often very sobering information with themselves. Other disciplines come in and address that one part of the person, but the nurse understands the whole person.
What drives you in your work?
Yeah, it's the connection, knowing that I can work on a project for a really long time for a patient and it finally comes to fruition is always really exciting. And I like that I work with a lot of really smart people and I get to learn a lot every day. There's always new treatments coming out or new ideas, and I like being able to learn all the time.
Rachel, let's talk about cancer specifically. You guys at Rush pride yourself on your cancer care. Why? What is it about Rush that you feel like you guys really excel at when it comes to cancer treatment?
When someone's diagnosed, we make a commitment to get a nurse phone call to that person within 24 hours from point of access. We try to get them into a provider within 7 days. So the name of our efforts is quick access to treatment. And truly, we are changing the paradigm at Rush from that of just treat to then we've moved to a space of survivorship. And now actually this year we're celebrating our first Thrivers Day because we're seeing a lot of patients because we get them to early screening as quick as possible. And the public is more educated about that than in years previous. Rush has a very robust screening and prevention mechanism within cancer services. But then because we also get them in quicker, to treatment, to surgery, to whatever else they need within radiation oncology or infusion, they're living longer. Their initial problem is treated quicker. And what's growing, we have this survivorship program, which helps us indicate when those patients should be seeing a physician into the potentially 30 or 40 years later. Like there is hope with early prevention and screening and the treatments we're able to mobilize. Not only is there hope for your prognosis, but there is a team that's really deep behind you.
And a big part of that team is nurses. And Rachel, what makes nurses so ready to meet this extraordinary moment in people's lives?
Nurses, because of our adaptive capacity and our situation across all points within the healthcare continuum, we're perfectly poised to bridge the gap between coverage and access. And this line I always share is to enable the full economic value of the nurse to be realized. We can't just be people who understand. We have to mobilize to make change in the lives of our patients related to that. Many of us are emphasizing that nursing must take a leadership role in literally transforming this for patients because we see the full picture of the patient.
What do you think separates Rush from other places in terms of how they handle nursing?
People always brag about Rush nursing. It's just a thing. It's just some culture that we have that everybody loves being a Rush nurse. People don't like to leave Rush. We just love working here. And I worked in a few different departments, and I find that no matter which department I'm in, it's kind of like its own little family and its own little culture. And you end up making lifelong connections with people you work with, even if you change departments.
New nurses see that Rush is serious about being involved in transforming healthcare and improving patients that are vulnerable, populations that are vulnerable, and having a presence within our immediate community to partner and make things better with many different community stakeholders. Even in our engagement surveys, it comes out that one point of pride in working at Rush is that Rush is involved in the community, is involved in what matters, is involved in making change for patients that maybe can't speak for themselves.
Is there any typical day?
Some days I'm in clinic all day with the provider I work with, and basically all of our patients get labs drawn and then we see them one by one. The provider sees the patient and then I go in after and do any follow-up care for them. So talking about how are they going to get their meds? How are they going to talk to their insurance about a certain thing? What infusions do they need? On the days that I'm in clinic, I see every patient that comes in. And then the days that I'm not seeing patients is calling insurance companies all day, talking to pharmacies, following up with patients on any issues they had the day before, triaging calls. Like if patients have a fever, that's a really big deal for us. So figuring out what should happen then.
Do you have any better luck with insurance than we do when we call?
I'd say I'm starting to learn some tricks, some keywords to use, but it's definitely frustrating.
you are kind of filling the void that I think a lot of people feel in healthcare, your role of just, wait, who do I talk to? Who's my advocate besides myself?
Yeah, patients are generally very thankful for our department because we work really hard. We follow them very closely and we work really well together as a team. We're there for people when they don't know where else to go.
Nurses are often seeing people on their worst days, right? Or on some of their worst days of their life. Mm-hmm. It takes a certain someone to do that. Yeah. Make the case for why nursing is this rewarding, stressful, overwhelming, exciting career all in one.
We have a commitment directly to society to improve their health. So we have a very clear mission in front of us. We have been seen as the most ethical and trusted profession for over 24 years now. That mission really brings you meaning. No matter where you work, you carry that meaning with you. If you're in the grocery store, if you're in the park, if you're, in a group of nurses that are working in the community setting, you carry that expertise with you wherever you go to make good. Because nursing has such a broad array of opportunities, really, truly, you can be in frontline care in multiple settings. You can be in research, facilitating clinical trials. You can be solely on the phone, navigating a patient.
Which is a lot of what Mel does. And I pivot to you, Mel, and talk about, your experiences as a nurse and looking, as we talked about a nursing shortage, why other people should maybe hop on into this profession or not.
Being a nurse is very hard, and there have definitely been times where I think to myself, why am I a nurse? But if you put in the time and the effort to build relationships with the patients, I think that's really what is so fulfilling. We're making a difference to people's lives for a very long time, and that's just a really special thing. It's just something you can't really explain, and each nurse has their own special connection with their patients that can't be replicated. And we're lucky that people trust us with during such a vulnerable part in their life. That's something that can't be replaced.
If you want a role that has incredible meaning and mission to it, and you want a role that's going to continue to have opportunity and, truthfully, a way to advance and make more salary, to have benefits such as tuition reimbursement, this is a very good role for that. It provides stability. Also, there's great amount of flexibility. For instance, I was full-time on the floor for 3 years. I did nights to save up for a house, right? Then when I was doing my master's, I went to weekender so that I could be free during the week to do school. So there is all these kind of options that allow you to grow as an individual while paying attention to your unique strengths and what you really want to use those strengths as to serve.
Why should someone apply to Rush specifically?
I think Rush is a special place with a special culture.
There is a very strong degree of camaraderie with your colleagues. And when you are going through things that potentially your family or others can't even understand with a colleague, that bond created makes you want to keep doing what you're doing. And I've been so honored to stand by so many colleagues over the years that I'm still in touch with, even that I started with.
I always tell a story of my mom was hospitalized for a couple weeks about 7 years ago. She was at a different hospital, not at Rush. And we ended up transferring her care to Rush later. And we were at Rush for a much shorter time. But in that shorter time, we connected with so many nurses that made us feel so comfortable and so heard. And even one of the nurses to this day, 7 years ago, I still talk to, and we're going to get lunch tomorrow. And it's just something about Rush nursing. I don't know what it is, that they're just special. They all go above and beyond. They all care so much. You can tell people are very dedicated and really care.
I find something poetic about that. One of the reasons you became a nurse is because your mom took care of you when you were sick, and you kind of took charge and brought her to where you knew she would be taken care of when she got sick.
Mm-hmm. Yeah.
Rachel, are you glad your dad came home that day with that suggestion to, hey, maybe you should become a nurse?
Yes. Yeah. The fact that he actually I just came home from an APN's house and you should be a nurse. The fact that it was Rush, really, I find to be super
Prophetic.
fortunate.
Yeah.
Yeah. Prophetic.
Dad must be happy for you too.
He is. He's very proud. Yeah.
For more on Rush, all that they do, nursing and beyond, you can go to rush.edu. I'll drop some helpful information in the episode show notes as well. Till next time, I'm John Hanson. Thanks so much for listening to the Block Club Chicago podcast. More stories at blockclubchicago.org. Take care.